The United States healthcare system is a myriad of private organizations working with and in spite of other private organizations in 50 separate countries. The ambulances are private, the hospitals are private, the bodies stack. This was meant to be the fun one, wasn't it? Crazy lady, living in a bag.
You're not allowed to crap on the sidewalk.
When, these new variants are going to want to surge.
Yes, that's right. I'm a British person talking about the American healthcare system. How novel. I live in America, and I have done since before the pandemic. I'm in America right now. Listen, you can hear. Hey, you get out of here. Get out of here. The scoops are on their way. The scoops are on their way. Sorry about that. Well, as the chatty plumber said to whoever it may concern, let's begin talking about this shower. The scoops are on their way. In the US, people who need medical care or medicine either pay for it directly or pay for it through health insurance. About 60 million American dudes and dudettes, 52 million of which are over 65, qualify for Medicare, which is the US's national health insurance scheme, and as close to free healthcare as it gets in the wild, 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 wild Midwest. The government's own accounting estimates that the average Medicare user has only about 50% of their total medical costs covered. Even if you're old or disabled, if you get hurt through no fault of your own, you're going to have to pay some of the bill one way or another. Right, yes, George complains, funny-ish. A man walks into a bar and says, "Ow! I am never going to financially recover from this." According to KFF, annual family premiums for employer-sponsored health insurance averaged out at $22,221 in 2021, or around $7,500 for an individual. Try paying that on your Taco Bell salary. Of course, if you have a pre-existing condition, or the zoo employs you as a gorilla antagonizer or something, you'll probably have to pay more. Even with insurance, the bill for being in an accident or just being sick can be crushing. And sometimes I feel like if you're from a place with universal healthcare, and this lovely Wikipedian graph here shows, in dark green, all the countries in the world with universal free healthcare, that's right, France, fucking France. If you're from somewhere that isn't America, this can sound like exaggeration, and I suppose vice versa. Well, this example is not at all atypical. In February of 2017, Shane Patrick Boyle started a GoFundMe asking for people to help him pay for his insulin. He tweeted twice more before he died, because he couldn't afford the medicine that he needed to live. There are thousands of stories like this. In fact, I'd bet there are millions. It is no exaggeration. In somewhere like Britain or France or Pakistan or Algeria or Mexico, you can go to the hospital and they will treat you for free, not only to the point of you no longer being about to imminently die, but in fact, until you have recovered. If you have to pay, it's usually for something like the medicine you take after you've been sent home, in the order of 20 local currency. Edit for region. In the US, hospitals are obliged to stabilize people so that they will not immediately die. If you want to stay for longer than that and can't pay, you either rack up the debt of a lifetime that will follow you forever, or you leave and die. That's if you've been hit by El Autobus. What happens if you have internal rot from working yourself to death, because God knows mandatory days off are downright communist, and you can't pay for the medicine that keeps you alive? Find a way to pay or die. No ifs, no buts. Don't go begging the insurance company. That happens all the time, and they don't care. Beg everyone around you. Beg random celebrities. Set up a GoFundMe so that kind people can fill the moral void. Get 5 jobs. Steal it. Or die. The US spends more than any other country on healthcare in the OECD, and for a place where they'll wheel you straight into death's marigolds, a lot of that is public expenditure. That's right, the US spends more per person on health than the UK does. Compared to the 10 other high-income countries previously shown, the US has the lowest life expectancy, the highest suicide rates, the highest rates of obesity, less doctors per person, and less visits to the doctor per person. The US has the highest rate of preventable deaths of this group and one of the highest of the 36 nations in the OECD. Don't let that one sink in. Let it float. The United States spends more per person in terms of both government and individual expenditure on healthcare than anywhere else in the world, except Tuvalu and the Marshall Islands. And amongst developing countries, it has a pretty bad rate of preventable deaths. So, almost the most expensive healthcare system in the world, definitely not the best health system in the world. And not free. Down here, we all float. Essentially, you can get top-notch, unequaled healthcare in the US if you are rich. If you're not rich, and by rich I mean multi-million rich, you probably won't. The reason it's so expensive is because the system is about profit, not care. The insurance companies operate a cartel where they collude to keep prices high. A typical angioplasty to open a blocked blood vessel costs around $6,500 US to perform in the Netherlands. The cost to perform, not the cost to patient. In the US, it costs about $32,000 for the exact same procedure. Hospitals are not all part of the same organization. They may work together, but they are privately owned businesses that all run things differently, under 50 separate states with their own laws. This leads to bloated administrative costs, and I mean bloated. An estimated 34.2% total healthcare expenditures in the United States are admin costs. And of course, there is little political impetus to change. Most politicians seem to be far more interested in special interests and making money for themselves. This is all exasperated by America's brutal take on workers' rights. Last year, I was walking my dog, Jessica Fletcher, when he pulled me too hard and I tripped over my own foot. I wasn't drinking at the time. And it's irrelevant. I'm sure I had tendinitis. Woe is me. Totally not serious, absolutely better now. Didn't get any grapes from you though. But if I'd have actually had a job where I had to stand up or if I had to drive to, well, there's no mandatory sick pay in the United States, so I could have missed 3 weeks' worth of income, and that's the best outcome, because there's very little in the way of worker protection. Unless you're flat out, clearly discriminated against, you can pretty much be dismissed here for anything on the spot. Right to work state. So really what would have happened is, if I'd have worked at Starbucks and said, "I'm sorry, I can't come in, I've hurt my foot," they'd have probably just fired me. That culture of "fuck you, I got mine" plays into all of this. Why don't you get your insert condition here looked at? Who can afford the money? Who can afford the time? Well, this is where the video would have ended 3 years ago, but thanks to COVID, the US healthcare system is buckling under the strain, and not just in terms of throughput. Throughput. I like saying that word when talking about human lives. Throughput. Client satisfaction. Team. The way doctors and nurses have been treated is despicable. Not only overworked, but now forgotten. they have gone from pillars of the community to targets of harassment and threats. Some hospital workers, who spend their professional lives in the most stressful, high-stakes environments, are apparently not too happy with being underprotected and used like some sort of lifeless resource. Some journalists and online forums for health professionals have been sounding the alarm on a system they say is collapsing. Apparently, nurses are leaving in droves, and really, who could blame them? But when the word collapse is used, for me at least, it conjures an image of an enormous building falling down in a very dramatic way. Really, it's more like that old house down the road. First the windows go, but it's fine. The open windows let in the weather, the walls start to rot. Eventually, that gets to the roof timbers. Then the ceilings fall in. It's still a house though. You could still live in it, technically. But before you know it, all of the roof is gone, and all of the walls too. And all that's left is a mess on the floor and the intact chimney. It won't collapse to the point it doesn't exist, it's just that it might collapse to the point where it's just a chimney. So now to actually end. I'm sure if you're an American, listening to Johnny Foreigner talk about how shit a certain aspect of your country is isn't exactly invigorating. Sorry about my channel. But I'm saying it because it's true. I'm not trying to sell you something, I don't want you to vote a particular way. As an outsider, this system is shameful and wrong. I like the idea of America. I like the American dream of a country without a king or a despot, where everyone is free, and you don't swear allegiance to a bloodline, you swear allegiance to a constitution. Okay, that's great. But this isn't a dream. This is like a nightmare. I could make an appeal to basic human decency now and say, everyone deserves free healthcare. It should be universal, it's a basic human right, and all of that is true, but I can do one better. For the taxpayer, in the long term, it would actually be cheaper to have universal healthcare, like a national health service in America. The only people it's benefiting are a handful of people who are getting very rich from people suffering, which I guess is the story of the theme of this channel now, and I am off. Thank you for watching. I'm gonna get drunk! Cheers. Bye-bye. Oh, wait. Yes, actually. The video's over now, but just a little chat. Once when I was about 10 or 11, I saw an episode of Malcolm in the Middle, a really early episode where Hal and Lois, the mom and dad of the family, of the group, are on vacation, and it's just the boys, and Malcolm ends up getting hit in the head. And the whole episode is about, oh, how can we, children, pay for the medical bill so that mum and dad don't get angry? And as a kid watching it, I didn't think, oh, that's how America works. I thought it was fantasy TV shit. I thought it was a joke, you know. The idea was so alien to me. It is crazy. And you're not so big. Life is unfair.